Our hearts, small tireless organs, are responsible for keeping us alive, pumping the blood that nourishes our entire body. When the heart is not well, it can have serious consequences for our health. However, often the warning signs go unnoticed. Today, in this documentary, we will delve deeply into 8 signs that your heart may not be functioning as it should. This is a matter of vital importance, and it is crucial that everyone understands the signals that the heart may be sending us. Before we explore these signs, we would like to remind you that if you find this information useful and valuable, consider subscribing to our channel to receive more health and wellness-related content. Let's begin. Sign 1. Chest pain. Chest pain is a warning sign that should not be ignored. It can be indicative of heart problems, although its causes may vary. When this pain occurs due to cardiac disorders, it is essential to understand the difference between angina and a heart attack. Angina is usually a tight and uncomfortable pain, resulting from temporary reduction of blood flow to the heart due to obstructions in the coronary arteries. On the other hand, a heart attack, or myocardial infarction, occurs when there is a complete and sudden obstruction of one of these arteries, causing damage to the heart muscle. Recognizing the difference between these chest pains is crucial. Angina pain often subsides with rest or the use of medications, while the pain of a heart attack can be intense and prolonged, often accompanied by symptoms such as shortness of breath, nausea, and sweating. If you experience chest pain that does not go away or is accompanied by other heart attack symptoms as described above, it is essential to seek medical help immediately. Sign 2. Shortness of breath. Shortness of breath is a symptom that can indicate heart problems, particularly heart failure. To understand this sign, it is crucial to comprehend the vital role of the heart in circulating oxygenated blood throughout the body. Heart failure occurs when the heart cannot efficiently pump blood, resulting in a buildup of fluid in the lungs and, consequently, shortness of breath. Shortness of breath associated with heart failure can occur during minimal physical activity or even at rest. It may be accompanied by other symptoms such as fatigue, swelling in the legs and ankles, and persistent cough. If you notice these symptoms, it is advisable to seek medical guidance to assess your heart function and determine the appropriate treatment. Sign 3. Heart palpitations. Feeling heart palpitations, meaning experiencing irregular, rapid, or strong heartbeats, can be alarming. In some cases, this can be a sign of heart arrhythmias, which are disturbances in heart rhythm. Arrhythmias can range from harmless to potentially serious, depending on the type and cause. Understanding what triggers these palpitations and when it is necessary to seek medical help is crucial. For example, if palpitations occur after excessive consumption of caffeine, alcohol, or in stressful situations, they may not be an immediate cause for concern. However, if palpitations occur for no apparent reason, are accompanied by dizziness, fainting, or difficulty breathing, it is essential to consult a healthcare professional for evaluation and an accurate diagnosis. Sign 4. Swelling in the legs and feet. Swelling in the legs, ankles, and feet is a warning sign that may indicate congestive heart failure. To understand this sign, it is necessary to recognize the importance of the heart in the circulatory system. When the heart cannot efficiently pump blood, fluid accumulates in the tissues, resulting in swelling. Swelling is often noticed in the lower extremities due to gravity, but can occur in other parts of the body. Additionally, it may be more pronounced later in the day. If you notice unexplained swelling, it is essential to consult a doctor to determine the underlying cause and initiate the appropriate treatment. Sign 5. Unexplained fatigue. Fatigue, although a vague symptom, can be a warning sign when it is persistent and does not improve with rest. Chronic fatigue can be associated with heart problems, as the compromised heart cannot adequately supply oxygenated blood to the body. Understanding how the heart affects our energy and overall well-being is crucial. Cardiac fatigue can be accompanied by other symptoms such as shortness of breath, swelling, and chest pain. If you are experiencing unexplained fatigue, especially if there are other symptoms, consult a doctor for evaluation and diagnosis. Sign 6. Dizziness and fainting. Dizziness and fainting can have cardiac roots, as problems in cerebral blood flow can lead to these symptoms. When the heart does not pump enough blood to the brain, it can result in dizziness or even fainting. It is important to understand how heart problems affect blood flow and which situations can trigger dizziness. If you experience unexplained dizziness or fainting, it is crucial to seek medical guidance to determine the underlying cause and the appropriate treatment. Sign 7. Neck, jaw, or back pain. Pain radiating to the neck, jaw, or back can be indicative of heart problems, especially when they occur together with other symptoms. This pain is the result of decreased blood flow to these areas due to obstructions in the coronary arteries. Understanding how and why pain can radiate is essential. If you feel pain in these regions, especially if it is accompanied by chest pain, shortness of breath, or other cardiac symptoms, do not hesitate to seek medical help for a comprehensive evaluation. Sign 8. Persistent high blood pressure. High blood pressure, or hypertension, is a significant risk factor for heart diseases. When blood pressure remains consistently high, the heart is forced to work harder, which can lead to a variety of heart problems, including an increased risk of stroke and coronary artery disease. It is essential to understand how high blood pressure affects the heart and why it is crucial to monitor it closely. Blood pressure can be controlled with lifestyle changes and, if necessary, medication prescribed by a doctor. Therefore, early detection and treatment of high blood pressure are vital for maintaining heart health. By knowing these 8 warning signs that your heart may not be functioning as it should, you will be better prepared to recognize when medical assistance is necessary. Remember, prevention and early detection are essential for a healthy and lasting life. We will continue to explore each of these signs in detail for a deeper understanding.